For more than 45 years, Interim HealthCare has been providing home health, hospice, and personal care.
Today, Patty Lewis and Kathy Rayner are here to tell us about a new Medicare benefit supporting patients and families living with dementia. This is such an important topic because, oh my gosh, dementia is one of those things you just pray you never get. You don't want your family to get it. It is such an awful disease. You've got things that can help, and it sounds like Medicare has introduced a new program. Tell us a little about what it is and the benefit that it offers.
Yeah. Thank you for letting us come on today to share this information. So Medicare's new program is called GUIDE, and it's all about trying to support those with dementia diagnosis and the families that are caring for them. As you said, no one ever wants to have a diagnosis like that, and it can be life-changing, overwhelming. So the GUIDE program is built around specifically supporting those with the dementia diagnosis by helping with education around the diagnosis, the stages of dementia, answering questions that families might have, and knowing what questions to even ask.
I would imagine it takes a toll on the entire family. The caregivers are such an important part of this story, right. and they probably feel like they're on an island a lot of times when it comes to information and resources. How is that going to help them just kind of feel like they have someone to reach out to, some questions that they can get answered?
Right. Well, right now, if you are a caregiver supporting someone with dementia, it can be, it's different from other physical ailments, It starts in different stages. There's different types of dementia even. So trying to directly connect families with resources is something new for Medicare. I'm really happy to see it. I've been in healthcare for a long time, and I think it's a game changer. Outside of giving them education and supporting them through that and connecting them with not only community resources, but other federal resources that might be available, there's an additional part of the GUIDE program that provides respite care for families, up to 80 hours of trained caregiver to help come in and care for that person while the family takes a break. Because we all know that we do a much better job taking care of people when we take care of ourselves.
Yes.
That's how it works.
Yes, and tell us too, how Interim really, plays a role in this.
Right. Well, we want families to be encouraged.
Yeah.
And when you're facing dementia, you can feel often alone, and we want them to know that it's okay and that it will be okay, and Interim is here to help. Certainly, one of the criteria that we have in looking at the GUIDE program so that we can help these families is if they qualify. So if you have a diagnosis of dementia and you have Medicare Part A and B, those are the two key factors that we look at. And from there, we take it from there to help. We partner with the families, and we want to be there for them every step of the way. And certainly the next step then is to get an in-home GUIDE assessment. And you get the in-home GUIDE assessment, which is free, and that gets you connected to all the services, everything including respite care, which is also free.
Wow, and those are services that people just wouldn't know about if you didn't come on to talk about it. Of course, it's a new program, but knowing that that's available to them is important.
Right, it's important for us to share this with families, especially critical right now. The numbers in South Carolina are great for dementia. We're seeing it every day in our services with personal care, and we really feel compelled to make sure that we let people know they can benefit from this service. If you have a diagnosis of dementia and you have regular traditional Medicare, please give us a call, because we really want to make sure that people have access to this service.
And that's going to be a game changer for so many families.
Yeah, thank y'all so much for doing that. And for people, like you said, they can get in touch with you. You can always go to interimcares.com to find out more information about their services. You can scan this QR code on your screen, which will link you to someone that can answer any questions you may have about that. But thank you both for all the work that you do and for informing our viewers about this very important topic. We appreciate it.
Thank you so
much.
Thank
y'all.
you.
Happy Thanksgiving to you.
Thank you.
Thank you so much.